Madison Cox, and I chose to do my presentation over the problems in nursing homes. In this presentation, I will be discussing a few problems that residents face while in the nursing home, a video showing terrible living conditions that led to the worst outcome you can imagine, the top complaint made by residents, and solutions to a few problems. Some problems in the nursing home consist of inadequate amount of staff, the environment, improper use of restraints, and improper use of behavior-modifying drugs. The first problem I will discuss is inadequate amount of staff. This is a problem because not enough workers equals fail to provide the necessary services they need. Employees are stretched thin. My mother-in-law is actually a CNA who works at a nursing home and said that she's had up to 20 single patients to take care of in one shift. The first problem leads to the top resident complaint, which is no one coming when the call bell is pressed. Now this can be for multiple reasons other than just the short amount of staff, but the number one reason is a nurse can't be in two places at once, and if she has to take care of 20 patients at a time, this can be hard to do. The second problem that I will discuss about the nursing homes is the environment the residents go through. It can be tough on a resident because they can experience boredom, depression, neglection, and sometimes even abuse. Research shows that it is possible to die from these characteristics from the environment. 1 out of every 3 people who are admitted die within a year, and only 15% are receiving hospice care. The bad thing about the environment is the terrible living conditions, and the next slide is going to play a video showing details of some of the living conditions a nursing home in Hollywood, California went through.
Now at 7, we have new video showing the conditions inside the Hollywood Hills Rehabilitation Center the evening before 8 residents died. The power at the nursing home went out because of Hurricane Irma, and the AC was not working. In the video, you can clearly see residents suffering in the sweltering heat as staff use fans to cool them. CBS 4's anchor Vanessa Borge reports.
The 34-second video shows a couple laying in their hospital gowns in their beds while a small fan sits on the nightstand next to them, as well as a cracked open window. The video was taken by the couple's daughter. She did not want to be identified. The footage is the first look into what kind of conditions the residents at the Hollywood Hills Rehabilitation Center were living in that caused 8 of them to die. In the middle of the video, the camera moves into a hallway where a naked woman is hunched over on what appears to be a hospital bed, her clothes gone in what can be assumed was an attempt to cool off. The video was shot Tuesday, but Hollywood Hills problems began Sunday at 3 p.m.
Okay, this slide is about the bad conditions related to the environment. These are claims admitted by CNAs who work in the nursing home. So 51% of CNAs at a nursing home have admitted yelling at a nursing home resident. 23% of certified nursing assistants at a nursing home have admitted insulting or swearing at a resident. 29% of the abuse complaints in nursing homes are from physical abuse. 21% of the abuse complaints in nursing homes are from psychological abuse. The next problem that I will talk about is the improper use of restraints. Using restraints on a resident is prohibited when it is being used for discipline or convenience. An example of restraint that has been used improperly is the vest that ties the residents into a wheelchair or a bed. The employee may say, "Your father may fall if we do not tie him into a chair. There is no way we can always be watching him." This is an example of using a restraint for convenience. This is a problem because under the nursing home reform law, A physical restraint can only be used to treat a resident's medical condition. The last problem that I will go over is the improper use of behavior modifying drugs. Like the improper use of restraints, this is a problem when it is used for discipline or convenience. An employee may say, "Your mother needs drugs to make her more manageable." Under the reform law, a behavior modifying drug can be used only to treat a specific condition. Behavior modifying drugs cannot be used for discipline or the nursing home's convenience. Now, this is the last problem that I will talk about, but these 4 problems are certainly not all of the problems within the nursing home, just the ones that I decided to talk about today. A solution for an inadequate amount of staff is hire more people. The environment solution is considering the patient's best interest, more activities, and lenient visiting schedules. For improper use of restraints is getting consent either from patient or the patient's representative, or keep a better eye on the patient. The solutions for the improper use of behavior modifying drugs is getting consent either from patient or patient's representative. That'll conclude my presentation. The next slide consists of my references, but other than that, I am finished. Thank you for listening and watching my presentation. Bye.